In the second video of the pharmacology of Antihelminthics, we'll focus on three important drugs, namely Pyrantel Pamoate, Levamisole, and Bephenium hydroxynaphthoate. In the previous video, when we discussed albendazole and mebendazole, I told you that antihelminthics or anthelmintics are a group of antiparasitic drugs that expel parasitic worms, also known as helminths, and other internal parasites from the body by either stunning or killing them, and without causing significant damage to the host. They may also be called vermifuges, those that stun the parasites, or vermicides, those that kill them. Pyrantel, Levamisole, and Bephenium are vermifuges, because they don't kill the parasites but make them lose their grip on the intestinal wall. Helminths are classified into roundworms, also known as nematodes, and flatworms. As an example of nematodes, we have Ascaris lumbricoides. Flatworms are further classified into trematodes, also known as flukes, for example Schistosoma mansoni, and tapeworms, also known as cystodes. As an example of cystodes, we have Tinea solium. Pyrantel, Levamisole, and Bephenium are antinematodal agents. These drugs are effective against Ascaris lumbricoides, which causes ascariasis, Enterobius vermicularis, also known as human pinworm, which causes enterobiasis, Ancylostoma duodenale, also known as Old World hookworm, and Nicator americanus. Ancylostoma duodenale and Nicator americanus are the two human hookworm species that are normally discussed together as the cause of hookworm infection. In this picture, you can see the cross-section of Ascaris lumbricoides. It consists of internal body cavity called pseudocolumn, intestine with epithelial cells that absorb glucose, amino acids, and other nutrients, muscle cells that contract and move parasite's body, oviduct, uterus, and ovary. All nematodes have a similar structure. Pyrantel, Levamisole, and Bephenium will disrupt some cellular processes in the muscle cells of the parasite. Let's zoom on the axon terminal of a motor neuron, the neuromuscular junction, and one muscle cell of the nematodes. The neuromuscular junction is the part where the nerve ending meets the muscle fiber. This is the site of chemical communication between a nerve fiber and a muscle cell. Also, you can see the sarcolemma, which is the plasma membrane of the muscle cell. At the axon terminal, there are vesicles filled with acetylcholine. When an action potential reaches the axon terminal, it causes the voltage-gated calcium channels to open, thus allowing calcium to enter the axon. This leads to the fusion of the vesicles with the cell membrane and the release of acetylcholine from the axon terminal. On the surface of the parasite's muscle cell are muscle-type nicotinic receptors, or NM for short, to which acetylcholine can bind and induce their opening. The opening of these channels lets sodium ions enter the muscle fiber and trigger muscle action potential. The potential travels along the surface of the sarcolemma, which is the membrane that surrounds those cylindrical structures known as myofibrils. The myofibrils are composed of small repeating units called sarcomeres. Here you can see the sarcomere during relaxation and contraction. T-tubules are extensions of the cell membrane that penetrate into the center of the muscle cell. T-tubules are surrounded by the sarcoplasmic reticulum, which constitutes the main intercellular calcium store. The action potential moves down the T-tubules. This causes calcium to be released from the sarcoplasmic reticulum, which leads to muscle contraction. The enzyme acetylcholinesterase, or ACHE for short, breaks down acetylcholine into its building block units, which are acetic acid and choline, to stop muscle contraction. Pyrantel pamoate, Levamisole, and Bephenium hydroxynaphthoate act as depolarizing neuromuscular blocking agents, thereby causing sudden contractions followed by paralysis in helminths. Okay, but how does that happen? They work by depolarizing the plasma membrane of the parasite, similar to acetylcholine. However, these three agents are more resistant to degradation by acetylcholinesterase. That's why the concentration of these drugs in the neuromuscular junction will increase. This differs from acetylcholine, which is rapidly degraded and only transiently depolarizes the muscle. There are two phases of the depolarizing block. During phase 1, also known as depolarizing phase, the drugs cause muscular fasciculations, also known as muscle twitches, and even muscle spasms. By the way, a fasciculation is a spontaneous and involuntary muscle contraction and relaxation. Fasciculations happen while the drugs are depolarizing the muscle fibers. Eventually, after sufficient depolarization has occurred, phase 2, also known as desensitizing phase, begins. The sodium channels close and the membrane repolarizes. However, due to continued stimulation by these agents, receptors become desensitized to acetylcholine, thus preventing the formation of further action potentials. This induces flaccid paralysis. At this point, a full neuromuscular block has been achieved. Flaccid paralysis makes the worms lose themselves. Look. Nope, just kidding. Flaccid paralysis makes the worms lose their grip on the intestinal wall and be passed out of the system by natural process. Since pyrantel is poorly absorbed by the host's intestine, the host is unaffected by the small dosage of medication used. That's why pyrantel does not appear to be harmful even during pregnancy. Paralyzing antihelminthics such as Pyrantel, Levamisole, and Bephenium may induce complete intestinal obstruction in a heavy worm load. This obstruction is usually in the form of a worm impaction and happens when a heavily parasitized human or animal is treated and tries to pass a large number of dislodged worms at once. Worms usually pass in the normal stool or with diarrhea and occasional vomiting. The side effects of these three agents include nausea, headache, dizziness, trouble sleeping, and rash. A lower dose should be used in people with liver disease. Pyrantel is on the World Health Organization's list of essential medicines. One of the more serious side effects of levamisole is agranulocytosis. In particular, neutrophils appear to be affected the most. Levamisole is very toxic, that's why in many countries is used as a dewormer in cattle, pigs, and sheep, but not in people. Levamisole is easily absorbed from the gastrointestinal tract and reaches peak plasma concentration in 1.5 to 2 hours. It's metabolized in the liver. Plasma elimination half-life, which is the time it takes for the concentration of the drug in the plasma to be reduced by 50%, is 3 to 4 hours, which can contribute to not detecting levamisole intoxication. The metabolite half-life is 16 hours. Levamisole's excretion is primarily through the kidneys, with about 70% being excreted over 3 days. Only 5% is excreted as unchanged levamisole. I think that's almost everything you need to know about the paralyzing antihelminthics. Stay tuned for the next video. Thank you for watching.